Okay, good evening, class.
Yeah. Selamat petang.
Okay, so today we're gonna talk about our first topic, bronchial asthma. Exacerbation of bronchial asthma, NBMH, and pressure meter dose inhaler. Before we start, so I'm gonna take this chance to ask if you guys already take your lunch just now.
Already.
Yeah. Nice. So I want you guys to see this picture. So, what is your idea about this picture?
People sangat banyak.
Okay, nice. This one, yeah. How about you?
Balls, lepas tu mama dia tu bagi itu.
Yes, nice answer. Yes.
Actually, there's a woman lah want to try to help you. Maybe his girlfriend, right?
Yes.
And there's also a child also using the NBI lah. So for our topic today, the learning outcomes will be like first to identify the triggering factor of the acute exacerbation of bronchial asthma, which is also NBMH, and its signs and symptoms, and also to explain the management of the NBMH using the pressurized NBI. And the third one will be to demonstrate proper technique in pressurized NBI application. So actually, what is actually bronchial asthma? Bronchial asthma is the air passage in the lungs become narrow, and due to the inflammation and tightening of the muscle around the small areas. For the definition of the acute exacerbation of bronchial asthma, actually it's an episode of rapidly progressive increase in shortness of breath, cough, wheezing, or chest tightness, or some combination of these symptoms which need an unscheduled visit. So, actually, what is a meter dose inhaler? Also, MDI. Actually, it's a MDI is a pressurized canister of medicine in a plastic holder with a mouthpiece. Actually, it's an inhaled respiratory medication. Will be used to take the medication lah. So when it's sprayed, it will give a reliable, consistent dose of medication. So actually, this is the small areas that I told you guys about just now. And then in the normal lung, this one also called as a bronchial. The small areas also called bronchial. So in a normal lung, actually the lining is normal. It's not that thick, and then the muscle also relax, and there's a normal amount of mucus there. But in a asthma lung, there is a swollen lining here. You can see it here. There's a swollen lining, and also there's excess mucus. One is yellow, one is the mucus, and also you can see here the muscle tightens. See, what's swollen, right? It's here. So this is the anatomy of the bronchial. We just see just now. Actually, the one that I said was this one. Is actually this one, right? So actually, this one is coming from here, the smallest areas lah that we discussed. So actually this is the MDI that I want you guys to know. So as you can see here, this is the MDI, where this one is the canister on the top of the diagram, and also this one is plastic holder, and there's also a cap. When we go through inside, actually inside the canister there's a drug formulation problem inside. For example, like salbutamol, it's a nice, there's a lot of things. Then there's also a metering valve here, and you can also see the nozzle here. where the spread here also. So actually, when there's a patient use, they will press on top of the canister here. See? So you guys with me?
Yes. Very good.
So actually, why these people actually getting the bronchial asthma? Where did they get? Actually, usually the people who have asthma actually come from the genetics, where maybe there's one of their parents got the asthma, or maybe their father got asthma, they will inherit the asthma. And then the second one, maybe got allergies like seafood and all the other things. And then for the respiratory infection, during early childhood, example, flu, an example like respiratory infection, like during early childhood, they will got the flu, and also the, like, for example, pneumonia, bronchitis, bronchopneumonia. During the infection, usually happen during the still infant, and there's the both causes of people getting bronchial asthma is because the environment. There's a contact with the allergen like dust and pollen. There's a lot of things, and also irritants like chlorine, and also exposure to the viral infection as an infant. So this is what actually the sign and symptom of a bronchial asthma patient. So actually there's a people who got the asthma usually will come with shortness of breath. They will holding their chest like this, shortness of breath, and also the feeling hurt in their chest, the tightness of the chest, and also the wheezing sound, and also got the excessive coughing or cough that will keep their awake at night. Did you guys ever heard about the wheezing sound? Not right now. So I'm going to show you the wheezing sound.
Feel. Bunyi berapa?
Actually, this is the wheezing sound. And this is the diagram of the people who got the sign of the symptom of the asthma. This one, like the one that I show you guys earlier, there's a dyspnea, they will got cough and also wheezing, as in the one that I just show you. And also they will got weakness, and then we will got the neck cough, headache, tachycardic, and then also allergies. And actually, why did people suddenly got the asthmatic attack? Actually, there's a triggering factor that causing them to have the asthma attack. The first one is, this is the common one, the smoking, and also the second-hand smoking, and also infections such as colds, flu or pneumonia, and also allergens such as food, pollen, mold, dust mites, and also exercise, and also air pollution, toxin, and also weather, where especially extreme changes in the temperature, and also drugs like aspirin, NSAID like ibuprofen, and also beta blockers, emotional stress, anxiety, and even a singing and laughing or crying, and perfume and fragrance also can trigger the asthma. And this is the picture for the asthma. So as you can see here, there's a lot of factors, and this one is the most common one, and then there also like stress, pets, exercise, bugs in the home, chemical fumes, cold air, fungus spores, and drugs. Okay. When we encounter our patients or our friends asthma attack, also known as ABA, we need to help them. So we need to know the management of the ABA. So today I'm going to show you guys the management of ABA using the MDI salbutamol, which is this one. And first, if you encounter a patient or friends outside of the house, example given at the house, office, and also maybe at the restaurant, if you encounter patients who having the SOB, so we need to ask them to rest first. We need to ask the patient to rest first, and then we'll ask about the history of the present illness, since when he already got the asthma, or maybe the symptoms. And also if you got the medication like salbutamol, and then after that, if the patient using this kind of medication, and then you are sure that he got the asthma, you will help them in the MDI. You will show them how to use this properly. So this is the notes that I can give for you guys to understand it more better. And also this the MDI salbutamol. Alright. So actually, if there's a inhalation step by step, and when we encounter a patient, and then we need to teach them, or maybe our friends. So the first step is we must sure that we remove the cap from the inhaler. We must remove first, and then the second one, we must check the inhaler well for 5 seconds. This 1, 2, 3, 4, 5. Yes. And then after that, we need to hold the inhaler firmly by placing the index finger on top of the canister and the thumb on the bottom of the mouthpiece. So like this. And then we need to make sure that the patient or our friends must sit straight, and also, or maybe we need to stand up, right? Okay. And the 5th step is you need to make sure that the patient tilts their head back slightly, slowly like this. Alright, nice. And the step 6 is you need to tell them to exhale away from the inhaler. Okay. Exhale away from the inhaler. So the step 7, you must put the inhaler in the mouth of the patient. You must put like this first, and then you press the inhaler, and start breathing in at the same time. So after that, after we take after we already push the inhaler, we need to take a slow and deep breath. Okay? Slow and very deep. And then after we done breath, we need to hold our breath for at least 10 seconds. And then you need to exhale slowly through your mouth or nose. Right? So I'm going to teach you how to do this. First, open the cap and then shake it well for 5 seconds. 1, 2, 3, 4, 5. Right? And then after that, you need to put it firmly in your hand. First, the index finger must on the top of the canister, and the thumb must be below one, and the mouth is one. And then you must make sure that the patient or friend must sit up straight or stand up. And then after that, they need to exhale away from the inhaler. Then after that, they will need to take the inside the mouth, and then push it, and then in the same time you also breathing.
Okay.
Then deep and slowly, and then after that need to hold for 10 seconds, and then after 10 seconds you need to release slowly also lah, and then from our mouth onwards. So is there any question you need to ask? Yes. So okay, so for this time I will ask for our learning outcomes today. So Mr. Mickey, can you tell me what is the triggering factor of acute exacerbation of bronchial asthma and its sign and symptoms?
Masa paling boleh kan?
Okay, kemudian
Oke, dari situ apa penyakit serangan asma adalah terjadi pada merokok, kemudian paru-paru, rambut, dan macam-macam yang menyebabkan simptom asma.
and the sign and symptoms.
Tanda-tanda serangan asma adalah batuk yang semakin teruk, sesak napas yang semakin teruk, dada ketat, dan lain-lain.
And what actually is the second learning outcome, which is what is the management of AMBA using the device NBI?
Pengurusan serangan asma, pertama sekali kita akan ke sakit. Lepas itu tanya sebab serangan atau jika ada penggunaan NBMH salbutamol, dan ajar teknik menggunakan NBMH salbutamol.
Okay, nice, thank you. And then for the third learning outcomes for today, I want to ask Mr. Mantan to demonstrate the proper technique in the NBI application.
Pertama kalinya kami bilang yang inhaler kan, bawa dari kotak, dan step-nya kita remove dia punya bentuk bangkit lah kan. Dan puncak dalam 5 saat macam itu lah. Dan yang langkah ketiga, cara pindahnya macam inilah. Tidak boleh lah, macam ada pindah begini. Jadi step keempat, kita kena kalau dalam keadaan duduk macam straight kan, ataupun dalam keadaan berdiri lah. Jadi biasanya sakit dirawat dalam keadaan duduk lah, sebab itu sudah kena pelan-pelan. Lepas itu yang langkah ke-6, tarik apa? Kita punya kepala di pelan-pelan, berulang-ulang macam straight. Dan langkah itu dari langkah ke-5. Sekarang langkah ke-6, jauhkan apa casing kita lah untuk ambil standby pernapasan kan sebelum kita menggunakan dalam sakit lah. Jadi langkah ke-7 dia, masukkan inhaler di kedua, dan press inhaler and start breathing. And after that, take the shower dan deep breath, ambil nafas yang dalam lah, dan remove. Lepas itu hembuskan semua melalui hidung atau mulut. Sudah sangat jelas cara penggunaannya.
Alright, okay, thank you Mr. Mantan and Mr. Miki. So for the video for the today, Then for any other question? So for the conclusion, can I ask Mrs. Sophie to give the conclusion for our topic today?
Oh, ada satu soalan.
Okay.
Ini inhaler kan, dia ada berapa jenis?
Usually the common one is the two lah.
Oh.
But the salbutamol usually the first choice lah.
Oh, okay. Yes, good. It's good.
The conclusion.
Thank you so much for this review. May I speak about it?
Okay.
Untuk kesimpulan dari pembelajaran kita berkenaan dengan bronkial asma itu, bronkial asma itu ialah keadaan di mana saluran udara bronkial dalam paru-paru menjadi sakit, sebab putus di sepanjang saluran mata. Tanda-tanda bronkial asma ialah sesak nafas, ada bunyi biji, batuk-batuk dan lain-lain lagi. Pencetus asma antaranya ialah merokok, kegiatan paru-paru, teraman dan lain-lain lagi. AEBA serangan asma ialah keadaan bila sesak nafas, sesak dada, batuk-batuk makin teruk. Jika ada rakan atau pesakit seperti ini, kita perlu tanya dahulu dapat sesak nafas dan tanya jika ada penggunaan NBMH. Kiranya ada, kita boleh tunjukkan teknik penggunaan yang betul. Terima kasih.
Alright, Miss. Okay, thank you, Mr. Sobi. It's a good conclusion from you. So this is the referral lah. I got all the information from this internet source. So I think that's all from me. Very thank you, guys.
Yeah,